The most common Medicare mistakes. Hi, I'm Bill Lewkowski, and I'm an independent Medicare insurance broker licensed in 34 states. And this video is going to talk about some of the more common Medicare mistakes that people make when they're first eligible for Medicare. So, who does this apply to? Well, you become eligible for Medicare either you are turning 65 or you worked past 65 and you had employer health insurance, but now you're leaving your employer plan and enrolling in Medicare, or you are under 65 and you have been receiving disability insurance through Social Security, you will become eligible for Medicare after 2 years of disability. So that would be the 25th month of your disability if you are under 65. So one thing you need to determine is, do I need to sign up for Medicare? Now, if you are disabled, you will need to have and sign up for Medicare on your 25th month of disability. And you have an initial enrollment period of 7 months to complete that to avoid any late lifetime penalties with Medicare. Now, for those that are 65 and older, you have what is called an initial enrollment period to sign up for Medicare. So, number one, if you plan on working past 65 and you're going to stay with your employer health insurance, you need to determine, do they have at least 20 employees and do they have what is considered credible health insurance? And most employer health group plans is credible insurance for Medicare. So you can stay on your employer insurance and delay signing up for Medicare and wait until you leave your employer plan, and you can do that at that time period and not have any penalties from Medicare. Now, if you are 65 and you are not working past 65, then you will need to sign up during what is called the initial enrollment period. This is a 7-month period that begins 3 months before your birth month. It includes your birth month and then 3 months after your birth month. So you need to sign up during this initial enrollment period to avoid any penalties from Medicare. If you are working past 65, but now you are leaving your employer plan, you will have a special enrollment period to sign up for Medicare. And I'll talk about that in just a moment here. But if you are turning 65, make sure to enroll into Medicare Parts A and B during your initial enrollment period to avoid lifetime Medicare late penalties. Now, if you are signing up after 65 because you are working, had health insurance with your employer, you'll need to determine when you're leaving your employer plan. And the first month after you leave that insurance begins a special enrollment period. Now, it's an 8-month period that you need to sign up to avoid any Medicare penalties. Now, there is one stipulation, and that is if you are going to sign up for Medicare Advantage, which is not original Medicare, that is a privatized version of Medicare, you have only 2 months after leaving your employer insurance to sign up without having any Medicare late penalties. So you have this 8-month period, but if Medicare Advantage is what you're going to be signing up for, you have a 2-month period to do that. Now, if you go with original Medicare along with a supplement, you'll also need to get a Part D drug plan. You have about 63 days after you leave your employer plan to sign up for Medicare Part D drug plan to avoid Part D penalties. Another common mistake is that if you are still working, but you're working for an employer with less than 20 employees, contact the benefits manager. But most likely, Medicare will take precedence in the line of your insurance. If you stay with your employer insurance, but they have less than 20, you're going to still need to have Medicare Part A and Part B. Now, you need to understand your late enrollment penalties if you have missed your enrollment periods. There will be late enrollment periods penalties that are for Part B and potentially for Part D, which is the drug plans. There will not be any penalties for Medicare Part A for most people because Medicare Part A does not have a premium and there is no penalty for those that have worked at least 10 years. Now, Medicare Part B, if you missed your special enrollment period or you missed your initial enrollment period, you potentially could have penalties of 10% each year that you passed your enrollment period and not sign up for Medicare Part B. Now, for Medicare Part D, if you don't sign up for a drug plan past 63 days of your enrollment period, you could have a 1% penalty each month after signing up after your late enrollment. So you want to make sure that you just sign up for Medicare A and B and you get a Part D drug plan during your initial enrollment period, or if you work past 65, during your special enrollment period. Another common mistake is not comparing original Medicare versus Medicare Advantage. You want to make sure that you understand all of your options, that you review the pros and cons of each avenue that you can take. I do recommend that you seek out a trusted independent Medicare insurance broker who can walk you through the difference between original Medicare and Medicare Advantage. This is one of the more important things that you need to understand. When you first are eligible for Medicare, you're going to have a choice between original Medicare and Medicare Advantage. Original Medicare has Parts A, which is hospital side of insurance, and Part B, which is your physician and outpatient side of insurance. And then most people will combine that with a Medicare supplement plan, or what's called a medigap policy. That fills the gaps of a lot of the out-of-pocket cost with original Medicare. You will also need to get a Part D prescription drug plan. So that is one option, is original Medicare combined with a supplement and a Part D drug plan. The other option that many people go with is what's called Medicare Advantage. This is really a privatized version of Medicare. It replaces original Medicare. It's administered through an insurance carrier, and that plan typically includes your drug coverage, and they also have other benefits. So it's important that you work with an independent Medicare broker who can show you all the options, show you what original Medicare and supplements look like, and a Medicare Part D plan looks like. What are the pros and cons of that option, versus also look at your Medicare Advantage options, the pros and cons and the options that are there. You also want to make sure that you don't have the mistake of, if you go with original Medicare, that you delay signing up for a medigap or a Medicare supplement policy. During your initial enrollment period, you can get a Medicare supplement without going through any medical underwriting. You only have this 7-month period to do this. After your initial enrollment period, in most cases, if you then want to add a medigap or a Medicare supplement policy, you will have to go through medical underwriting. And in some cases, you would not qualify for a supplement. So it's important to not delay the purchase. If you're going to go with original Medicare with a supplement, sign up for a supplement during your initial enrollment period. So if you do go with Medicare Advantage, one common mistake that you want to avoid is to make sure your doctors, your hospitals, and your medications are in the Medicare Advantage plan that you're enrolling to. Now, these Medicare Advantage plans are year plans. They change every year. You will go through an annual enrollment every year to update your plan. But when you initially enroll, you want to make sure that your doctors and your hospitals and your medications are incorporated and included in the plan. Medicare Advantage plans have a preferred provider network. And if your doctors are not in there, or your hospitals are not in that network, you may not be able to use them, or you may be paying a lot more money to use them. So you want to make sure you're clear of your options and you pick the right Medicare Advantage plan. The same thing goes for your medications. Make sure that your medication is in what's called the drug formulary, so that you will not be paying for your drugs out of pocket. You want to make sure the plan covers that. So, and the other thing about Medicare Advantage is you want to make sure you understand that with Medicare Advantage, you are with a Medicare insurance carrier. They also require, in a lot of cases, prior authorizations for certain referrals and procedures. That's quite different than original Medicare. Original Medicare gives you the freedom to go to any doctor and any hospital that takes Medicare, which is over 99% of those across the country. So that's why I recommend that you work with a independent Medicare insurance broker to help avoid these mistakes, to help be your advocate, to be your advocate that's looking out for your best interests, to help inform you of your options, to understand the difference between original Medicare, Medicare supplements versus Medicare Advantage, and that you get this all established in your initial enrollment period so that you will avoid any long-term Medicare penalties.